This
your
conference will
understanding
now
the
be recorded.
Annavaha srotas, we need to understand the GIT plus there is something. So this is the very basic understanding of GIT and the Annavaha srotas. We have the different srotases from the Charaka Samhita. We have the 13 set of srotases, prana, udaka, and annavaha, where the vaha means vahana of something. There will be the flow of something. Prana, if the prana is flowing, then it is the prana. Annavaha, anna is flowing. Then the dhatus are flowing. Then they are the dhatuha srotas. And the mala is flowing, mutra, purusha, or sveda. Then it is the malavaha srotases. So with this, if you see the Annavaha srotas with the GIT, we will come up across with the Talu, Mula, and Kloma. It may be a part of GIT. And in the Annavaha srotas, Amasha and the Vamaparshva. Then in Purushava srotas, Pakwashaya and Stulagada. These all are the part of the GIT. Then see, the GIT is extended from the mouth up to the anus, but from the Ayurvedic understanding, it is of the mainly of the three sets of srotases. One is Udakva srotas, Talu, Mula, and Kloma, the oral cavity, Amashaya Mula and Vamaparshva, the upper GI, and the Pakwashaya and the Stulaguda, the lower GI. So with this understanding, a holistic approach is needed. So when you start a treatment of any person, we will call that Ayurveda is an holistic science. So what is the holistic means? We will not see a person as a part by part. If any patient comes with any diseases or any symptoms, take a for example of person is coming with the chati, will not take him as only afflicted from the Annavaha. If the person is coming with the Atisara, we will not take him as only with the Purushava srotho dusti. It is the part of the modern understanding. For right hand, there is some doctor. For the left hand, there is some doctor. But from the Ayurvedic aspect, we need to understand as a whole person. So that is with the holistic approach. All the srotases with these concepts, we will be heading for the understandings. Coming to the Annavaha srotho dusti nidanas, mainly Atimatra, Akala, Ahita Bhojana, and Vaigunyat Pavakasticha. Four main Samanya Nidana for Annavaha srotho dusti: Atimatra, Akala, Ahita Bhojana, and Agni dusti, which are most common food habits and our lifestyle habit, which is leading for many disorders. If you see any person, if you ask him, he will tell about these things. If you take the history of any person, the person will tell that he may be having the Atimatrahara, untimely food, and he will not be taking a Hita Bhojana and the Agni Dushti. So we'll see about the Agni Dushti, why the Agni Dushti will directly influence on the Annavaha srotas. So these are the Agni Dushti Nidanas, Abhojanat. So for the present day lifestyle, if you understand these, all the Nidanas, were very easily get in all the patients. And the Annavaha srota dushti is something, if you see any disorders, we will see the one or other lakshanas of Annavaha srotas. It may be from the Jwara up to the Univapath. If you see the diseases, there will be the lakshanas of Annavaha srota dushti. So in the Agni dushti, abhojanat, if the person is not taking the enough food, it may lead to the Agni dushti and the Annavaha srota dushti. Jirna, ati, abhojana, vishamashanat, excessive eating. A person is excessively eating, then also it will influence the Annavaha srotas. Asatme, guru, shita, atiruksha, atisandushta, bhojanat. Then these type of food habits are most common in the contemporary lifestyle. Then from the Ayurvedic aspect, Panchakarma Apacharaja. If we are not fixing the Sneha or our Vamana and Virechana is not done properly, then it may also lead for the Annavaha srotho dushti vikara and the Agni dushti, Vyadhi Karshana, and the change in the Desha Kala Rutu and the Vegadharana. There are some occupations where the person will go for the Vegadharana. So person may be coming with some other disorders. If you take the history, person's occupation, the person may be like the conductor, or the person may be the traffic police. He will be having the continuous Vegadharana, or the students, sometimes the students, they will be continuously having some Vegadharana, and it will have the impact on Annavaha srotho dusti. Then coming to the Lakshana, as already told that if you see any diseases, there will be a one or other Annavaha srotho dusti Lakshanas. Ananabhilasha, Arochaka, Avipaka, Charti. So basically he has given 4 sets of Lakshanas for Annavaha srotho dushtis. Ananabhilasha person will not be able to have the Abhilasha for the Anna. Even though if it takes the food, there will be the arochaka. Even though if it takes the food, then there may be the no digestion, avipaka. Then it may lead for the charti. So these are some Annavaha srotho dushti lakshanas. Then coming to the first, we'll understand how the Agni will have the symptoms of Annavaha srotho dushti lakshanas. First is Vishamagni. Vishamagni will lead for Admana, Shula, Udavarta, Attisara, Jatara, Antragaurava, and Antrakurjana and Pravahana. See, these are symptoms of Annavaha srotho dushti, but it is the basic causes from the Vishamagni. So Vishamagni will lead for these all the Lakshanas of Annavaha srothas. Coming to the Tikshna Agni, it is easily told that Prabhutam Annam Upayuktam Ashuhu Pachati. Person is taking a large quantity of food, but it is digesting very fast. And in the digestion, and the person will start taking muhur muhur, repeatedly will start taking the food. And the person's gala, talo, oshta, shosha will be seen. See, it is Agni Dushti is there, Annavaha srothas is there, but the Lakshanas are seen in Udakva srothas. Gala, Talu, Oshta, Shosha will be seen. So for that only, a holistic approach is needed for the Annavaha srothas. So this is about the Tikshnagni, have the impact on the Annavaha srothas. Coming to the Mandagni, we know that Mandagni is the cause for all the disease. Sarva rogo mandagnopi. Repeatedly we will tell that Sarva rogo mandagnopi. So what is the understanding of the Mandagni and with the relation to the Annavaha srothas is Alpam Mahata Kalena. The person is taking very little quantity of food, but it is taking a lot more time for the digestion. Alpahara is there, but the person will taking a maximum time duration for the digestion of ahar. And in the process of the digestion, person will also feel udara, shirogaurava, kasa, shwasa, praseka, chardi, gatra sadana. These all the lakshanas will also the person will feel. Person will take a small quantity of food and will say that my stomach is full. I am feeling the heaviness in the stomach. So these type of lakshanas are purely of the mandagni and with the relation with Annavaha srothas. The coming to the dosha relation with Vishamagni, Tikshnagni and Mandagni, it is the Vataja, which is leading for the Vishamagni, Pittaja is for the Tikshnagni, and the Kapha is for the Mandagni. So why this is important? Because when you understand the Ajirna, coming to the Ajirna, we have the different sets of Ajirna. So in the Ajirna, Ama Ajirna, Vigdagda Ajirna and Vishtabda Ajirna. Their symptoms are with the relation of the dosha and the Agni. Ama Ajirna is due to the Kapha and due to the Mandagni. So Mandagni Lakshanas will be seen in the Ama Ajirna. Pitta will lead for Vidagda Ajirna due to the Tikshnagni, and the Vishtabda Ajirna is due to the Vata and from the Vishamagni. Then we have the very particular observations like Rasashesha Ajirna. Rasashesha Ajirna means there is a still shesha of the rasa and the person is having some nidanas will lead for the Ajirna. Dinapaki ajirna. Person will take a 1 day for a paka. Then that ajirna is dinapaki ajirna, and the prakruta ajirna. Prakruta ajirna, the person has taken the food until the completion of the digestion, it is the ajirna. So that is the prakruta ajirna. So ajirna is the most common symptom we can see in any person, or the person is of having any disorder. You can see the ajirna lakshanas, and we need to understand that is it due to the kapha, pitta or vata, and according to our treatment protocol will changes. Coming to the modern understanding of the ajirna, it is a very simple symptom. If any person tells that indigestion, it's a very simple symptom from the modern understanding. But from our understanding, it is a unique and a basic understanding of our treatment protocol. Without the understanding of the ajirna or the agni, we can't write a single prescription. Okay, for that only the understanding of agni and the ajirna will become very important. Dyspepsia or the indigestion refers to the discomfort or the pain occurs in upper abdomen even after eating or the drinking of the food. It's not a disease from the contemporary understanding. Person will show the bloating, discomfort, feeling of the fullness, nausea, etc. Most of the modern gastroenterologists also they will skip this type of history, but for an ayurvedic physician, the clinical examination or the history taking of the ajirna, agni mandya, ajirna, and the status of agnis will become a very important. Coming to the chardi is another very important disease from the Annavaha srothos. So in the chardi, it is an expulsion of the gastric content. So vomiting, expulsion, forceful expulsion of the gastric content, maybe the food plus gastric content. It's not only the undigested food. It is the food plus gastric content. For that only he will tell that doshaha vaktram dvidanascha. So the doshas will be getting expelled out of from the vaktra. And he will tell that it is not the simple expulsion. The person will have some angabanjanehi. Person will show some particular posture. A person can't vomit simply sitting. For the vomiting, the whole body has to come into one position. His spine, his neck muscle, his abdomen, his chest, and all the internal organs will involve in the process of the chardi. So that is the understanding. It's not a merely a vomiting. It is a complete the neuro CNS plus GI involvement will be there in the chardi. If you see the chardi samprapti, doshan udirayat vruddho udhanu vyana sangha. So there is a sangha and the vimarga gamana. Both can be seen at a time. The vata is not moving downwards and some vata is taking the gastric content in the upward direction. So urdhva gacchati. So gastric content will be expelled out from the oral cavity. So that is the chardi. If you see the different types of chardi, vataja, pittaja, kaphaja, sannipataja, etc., you can see if it is vataja, there will be the pain dominated, shula dominated chardi will be there. Person will have the shula first, then suddenly there will be the chardi in pittaja. After the chardi, there will be the burning sensation, daha, etc. will be there. In kaphaja, still the person will be having the heaviness. And there are a particular or a very important observations like Dushtartha Samyogaja Chardi or Bivatsya Chardi. There are some persons where just seeing the rakta or some mamsa or any unwholesome gandha, ashana or darshan, if they see the smell, they will vomit. If they see some unwholesome image, they will vomit. Or if they take some unwholesome food, they will vomit. It is the Dushtartha Samyogaja, and where there is an involvement of mana. For that only, there is a relation between the mana and to the Annava Srotas. So if the mana is good, the person's Annava Srotas will also be good. So this is one example. And we have the Krumija Chardi. So in the next slides, when we'll see the Krumi, we'll see about the Krumija Chardi also. The Gulma is a very important understanding in the relation with Annava Srotas and the in total of the Koshta. So person will be having Runnabi Parshvo Bastir Shulaha. So Shula Pradhana, it is without the Vata, there will not be the Gulma, and it is Parsha Upalabhyate Paripindatvat. So Gulma, it is a simile is given as of the Gulma is as of the herb. It will be the deep rooted, there will be the Sparsha Upalabhyate will be there, and person will have the Shula. So the same thing is taken out and made into the Shula, Parinama Shula, and Annadrava Shula. So if it is became chronic, then it is an Gulma with the Paripindatvat, and if it is a simple Shula, then next we'll see about what is the Parinama Shula and the Annadrava Shula. So Madhavakara has given the in detail about the Shula, Parinama Shula, and Annadrava Shula. Shula, if we use the word Shula, according to the context, the meaning of the Shula will change. If the person is telling about Shira Shula, it's related to Shira, related to the Shira Shula, or Kati Shula, Griva Shula, etc. If you are telling in the Annava Srotas, it is related to the Parinama Shula and Annadrava Shula. So coming to the Parinama Shula, a very important is Bhukte Jirate Yat Shulam Tadeva Parinamajam. Parinama. So person will have the Shula at the Bhukte Jirate, at the end of the digestion. So at the end of the digestion, at the Parinama, there will be the Shula. Then the Annadrava Shula, and with that also in the Parinama Shula, we have the Vataja, Pittaja, Kafaja Lakshanas. Then the Annadrava Shula is something which is not having any aggravating and the relieving factor, irrespective of the Bhojana, Abhojana, Patya or Apatya Prayoga, Jirna or Ajirnat. Person is taking the food or person is not taking the food, it is not influencing on the Shula. The Shula is continuous, or it is the irrespective of the Bhojana or Abhojana. But in Parinama Shula, if the person takes the food, the Shula will be subsided. Or at the end of the digestion, person will have the Shula. Na Shamam Yanti is the for the Annadrava Shula. Okay. So in the contemporary understanding, we have a very important concept of the peptic ulcer. Peptic ulcer disease, our stomach is having the acidic in nature, stomach contents will be having the acidic. For that, there is a lining for the protection of the stomach. If that part is broken down, that continuation is lost, then it's called as the ulcer. If it is due to the peptic acid, then it is a peptic ulcer diseases. Mainly from the stomach, then it is the gastric ulcer. If it is there in the duodenum, then it is a duodenal ulcer. So signs and symptoms of peptic ulcers is abdominal pain, particularly on the epigastric pain, then the bloating of the abdomen, abdominal fullness, nausea, vomiting, then the loss of appetite, weight loss. In one case, there will be the weight loss. In another case, there will be the weight gain. Hematemesis in the gastric ulcer, melena in the duodenal ulcer, and in the very severe stages, there will be the perforations. The causes for peptic ulcer is food habit, stress, and H. pylori infections and the NSAIDs, and some other drugs like the aspirin, etc. These are the major causes for the peptic ulcers. We need to mainly differentiate between the gastric ulcer and the duodenal ulcer. Gastric ulcer is something where the pain after the food intake will increases, and the duodenal ulcer pain before the food intake will be seen. The periodicity is less in the gastric ulcer and periodicity is more in the duodenal ulcer. Hematemesis is common in gastric ulcer, and in the duodenal ulcers, the melena is seen. Weight loss in the gastric ulcer, weight gain in the duodenal ulcer, as the person will, if the person has the empty stomach, will have the pain, so he will eat the food, so that again the weight gain will be seen. These are the gastric ulcer and the duodenal ulcer differentiation. Nowadays, in the present scenario, we are not having too much of the complications of the gastric or duodenal ulcer. If about 25 years or the 30 years back, the general surgeon used to go for the gastroenterectomy. If the person is having gastric ulcer or duodenal ulcer, they used to cut the part of the gastrium and anastomosis it. But nowadays, due to proton pump inhibitors like the pantoprazole, then omeprazole, and the Rantac, the complications of the gastric ulcer leading for perforation, peritonitis are reduced. But still, we will get these gastric ulcer and duodenal ulcer as an main symptoms. Next is the Amla Pitta. Amla Pitta is a most common disorder or the most common thing we'll see in the Annavaha srotho dusti. He is given as a simile, so it is beautifully explained from the Kashyapa Samhita. If you put a kshira in uncleaned curd vessel, so first already you had put the curd, but you had not cleaned it, and again you had put the kshira in it. Then what will happen? It will become kruchri bhavam. It will suddenly it will ferment. Shuktata will occur. Similarly, person has taken the food. It is not, the anna is not completely transferred into the rasadhatu. Again, you had put the food into the amasya. Then what will happen? It will go into the shuktata. That will lead to the amli bhavata with the pitta leading for amla pitta. And we have the classical symptoms like avipaka, klama, klesha, tikta amla udgara. Person will have the tikta amla udgara, gaurava, rutkantadaha. Person will feel the kantadaha. Then the classification we have the urdhvaga amla pitta and adhoga amla pitta. So in the urdhvaga amla pitta, chardi lakshanas will be seen. Person will have the rutkantadaha, etc. In adhoga amla pitta, shuktatva of the rasa will go into the pakwashaya and lead for the different symptoms. So that is the urdhvaga and the adhoga amla pitta. From the contemporary understanding, the gastroesophageal reflux disease. Whatever the food will take, it will go into the stomach, and the it will never come out of the stomach to the esophagus. It has to go forward. When a small drop of water will also not come out of the stomach into the esophagus. But in esophageal reflux disease, is a chronic condition where the stomach content will rise up into the esophagus, resulting some symptoms and the complication. So that person will have a classical taste of acid in the back of the mouth, heartburn, bad breath, chest pain, regurgitation, then the breathing problem. These all can be seen in gastroesophageal reflux disease. Then coming to the Atisara. So Atisara, even though it is Purusha srotho vikara, but it has a link with Annavasrotas. So first there will be the Agni dusti, and the Jaliya dhatus will mix up with the Shakrut. So for that only, starting only I told, it is not a single entity. We need to understand. We need to understand with a holistic approach. If you are seeing the Atisara, it is not only the Purushava Srotho Dushti. We need to again understand the Agni Dushti and the relation with the Annava Srotas. So Agni, first Agni Dushti will be there, then the Jaliya Dhatus will mix up with the Shakrut and lead for the Atisara. And we have a classical observation of the Shokaja Atisara and the Amaja Atisara. Then the Pravahika. So in the Pravahika, person will have the Pravahanam Muhur Malayuktam. So here person used to tin it for the Mala Pravrutti, then it is with the Kapha. So why I am considered this again Atisara and Pravahika, it is they are related to the GIT. Okay. Coming to the Grahani. Grahani is a very basic understanding for the Annavasrotas, where all the Agni Dushtis are explained. Agni Dushtis, Grahani Dosha is the purely for the Agni Dushti. Grahani Nala Vikriti is the anatomical deformity of the Grahani. So Grahani is in between the Amashaya and the Pakwashaya, and the Grahani Dosha is purely of the Agni Dushti. So person will have the Atisuftam, Vibandham, Dravam, etc. Lakshanas. Sometimes he will be having the Atisufta Mala or Vibaddavala, or the Dravamala or Vibaddavala. So these type of Lakshanas are most commonly seen in the IBS. So from the contemporary understanding, the gastritis is the inflammation of the lining of the stomach. Abdominal pain and the nausea vomiting are the most common symptoms seen in gastritis. See, most commonly we'll use the word gastritis. So gastritis is the inflammation, but we need to find out what is the cause for the gastritis. Gastroenteritis is the inflammation of stomach and the intestine. The most common reasons for gastroenteritis are the infective, bacterial, viral, parasitic, or any microbial toxin related gastroenteritis. So symptoms are the diarrhea, loss of appetite, dysentery, etc. Okay, so there is a classical difference between the diarrhea and the dysentery. In diarrhea, the voluminous liquid fluid feces will be expelled out. In the dysentery, scanty sticky fecal matter will be expelled out. IBD, inflammatory bowel disease, is another important in the present day scenario. We will have many patients of the IBD and the IBS. So there is a difference between IBD and the IBS. So inflammatory bowel disease is a group of the inflammatory condition of colon and the small intestine. The most common disorder are the Crohn's disease and the ulcerative colitis, where the colon and the small intestines became inflamed. A basic difference between Crohn's and the ulcerative colitis is Crohn's disease can be seen in any part of the colon and the small intestine, but the ulcerative colitis is mainly seen in the last part of the colon. Okay, and there is a patchy pattern in the Crohn's disease, but the continuous pattern in the ulcerative colitis. IBS, most of the time the patient will exhibit here the Manavasrotas, Annavasrotas, Purushasrotas. All the srotas are seen here in the IBS. See, IBS is functional gastrointestinal disorder characterized by some group of symptoms where person sometimes will be having the diarrhea, sometimes may be having the constipation, sometimes the alternative, sometimes the mix. These all the lakshanas are seen in the IBS. So according to that, they are classified as the IBS, diarrhea common, IBS constipation common, IBS both are common, and post-infectious IBS. Udara Roga is another big purview for the Annavasrotas, where the Agni, Prana, and the Apana is involved, and the Kukshi Admana is seen. Kukshi Admana is seen. That only I had considered in the Annavasrotas here. Those are not needed. Baddha Gudodara. In particularly, the Baddha Gudodara. Why and what is the relation with the GI? We'll see here. There are a mechanical, see, the bowel obstruction may be the mechanical or the functional obstruction to the bowel. The intestinal obstruction can be the Baddha Gudodara. The reasons for this obstruction may be the adhesion, hernia, volvulus, endometriosis, IBD, appendicitis, then the tumors, diverticulitis, the TB, and the intersusceptions. So these mechanical and the functional obstructions may also be considered as the Baddha Gudodara. Chidrodara, where we will see the gastrointestinal perforation. The traumatic origin, where the person have any trauma to the intestine, with the lakshanas of the srotho with the lakshanas of Annavaha and the Purushava srotho with the lakshanas can be seen in gastrointestinal perforation, eating a sharp object, a medical procedure like the colonoscopy, complication of the colonoscopy, then diseases like the ulcers. The gastric ulcers may also lead for gastrointestinal perforation and can be correlated with the Chidrodara. And the lastly, the krumi. So in the krumi, we have the 20 types of krumi, and in particularly Shleshmaja krimi, where the ashaya for the Shleshmaja krimi is the amashaya. For the Purushari krimi, the ashaya for the Purushari krimi is the pakvashaya. So the both upper GI and the lower GI is involved in. If the krimis are involved, then if the amashaya is involved, Shleshmaja krimis are there, person will show more of the chardi lakshanas. If the person is having pakvashayagata krimis, atisara lakshanas. Okay, so different types of worm, helminthiasis, tapeworm, then roundworm, ascariasis, those all are related to the krimis. Then the Udavarta is another very important concept. There are 13 types of Udavartas which are related to the Annavasrotas and the Purushasrotas is Apanavata Vegadarana, Purusha Vegadarana, Chardir Vegadarana, and Annaja Udavarta. So these Udavartas also can be studied under the purview of Annavasrota Dusti vikaras. Okay, so coming to the conclusion, anatomical and functional understanding of srotas is very important. Agni Dushti plays a major role in manifestations of many Annavasrota vikaras. Differentiating of the dosha involvement in Ajirna, Chardi, Atisara will help us to choose the specific treatment protocol. See, if the Ajirna is there, if it is Vataja Ajirna, our treatment protocol will change. If it is Kaphaja Ajirna, our treatment protocol will change. And if it is Pittaja Ajirna, our treatment protocol will change. So doshic understanding in any disorder, in particularly in the Annavasrotas or in any GI disorders, will help us for a better choosing of the Ayurvedic treatment. With this, I wish to thank the management, principal, vice principal, staff of SBG Ayurveda Medical College, Belagavi, and organizer for the Nidana Siddhi and all the participants for the patient's hearing. If you have any queries, you are open.
Sir, one query is there.
Yes, ma'am.
Sir, how to diagnose whether it is Parinamashula or Annadravashula, where in both conditions during Jarana there will be pain? It's okay.
Okay, see, basically Annadravashula and Parinamashula, for that only. See, in Annadravashula, it is from the Upashaya and Anupashaya. Okay, so in the Nidana Panchaka, we have the Upashaya and the Anupashaya. The Annadravashula will not be irrespective of Bhojana, Abhojana, Patya or Apatya. So when you will take the history of the Parinamashula or Annadravashula, if the person is not relating the pain with Bhojana or Abhojana, person will tell that if I take the food or if I don't take the food, the pain is continuous. If I having the digestion of the food, if the digestion is not happened, then also the continuous food, then it is the Annadravashula. Parinamashula is something when there is the digestion is over, then the person will have the parinama and person will have the shula. So on the clinical history taking only, we have to differentiate the parinamashula and the annadravashula. Right?
So the next question is, how can we differentiate between Atisara, Grahani and Pravahika clinically?
Yes. See, most simplest. See, in Atisara, the person will have.
Atisara,
Yes, no? Atisara, Grahani and
Atisara, Grahani and Pravahika clinically.
Okay. Clinically, see, ask the patient if the person is having the Atisara, person will have the loose water stool, Atisravana of the mala will be there, liquid stool will be there. If the person is having Grahani, it is not more related to the Purusha Srotas. The person will have the indigestion, person will have the Agni Dushtis. And in the Pravahika, person will not be having too much of the liquid stool. Person will have the stool with the stickiness and with the kapha. Then it is the Pravahika. And he need to Pravahana. He need to put the pressure for the Pravaha. Then it is the Pravahika. Okay.
Hello, sir.
Yes, ma'am.
Sir, it was muted, I think.
No. Am I audible, ma'am?
Can you
No?
please? Yes, sir. Yes, sir. Now you are audible,
Okay.
sir.
Okay. Okay.
Shall I move to next question, sir?
Yes, ma'am. Yes, please.
Sir, the next question is, only Agni Dusti is responsible for manifestation of Vyadhi or what?
No, definitely. See, Agni Dushti is the initiation for a disease. Okay. Without the Agni Dushti also the person may have different diseases. At that time, it may be the anatomical deformity. Person is born with some anatomical deformity. There is a no directly the Agni Dushti. But person has taken some Nidanas, then there is Agni Dushti, and from that Agni Dushti, there should be the Dosha Dosha Sammurchan. Then only a disease will occur. But for that, there is the initiation is from the Agni Dushti.
Okay, sir. So next question is, can you please explain what exactly Agni Mandya is?
See, Agni Mandya, everyone is having some digestion, some digestive power. See, Agni is generally we will call it as a fire. A fire is there, we'll put something on it, it will burn. But it has some capacity. So whatever we'll put it, it will burn. If we put excessive, then it will lose its capacity and it will extinguish. If we'll not put something on that, then also it will get extinguished. So Agnimanda is something when the digestive capacity of a person is reduced and it is leading for the diseases. Then it is called as Agni Mandya. Before the disease, person is taking 3 times food, he is getting digestion. So for Ahara Parinama, we need either 2 ayama. Okay, if I take the food at 1 o'clock, so it will get digestion after the 2 hours, about the 2 hours. It is some person, it may be the normal. But sometimes what will happen, you have taken, yesterday you have taken the enough food at the night. In the next day, the person will not be able to digest the food within the 2 hours. He may take the 3 hours. Then there is an Agni Madhya. If the same thing goes on, if it is the same thing goes for the chronic, then the person will have the severe impacts.
Yes, sir. Sir, the next question is how we can correlate Alasaka and Visuchika with modern science?
Yeah. See, I had not included the Alasaka, Visuchika, and the Vilambaka. Why? Because Alasaka, they are also a part of the srotho dusti vikara. They are more of a conditions where the person will have the ama visham. See, Alasaka, Visuchika, and Vilambika, they are explained with the ama visham. Agni dusti will be there, ama production will be there, and there are some systematic symptoms. So in the Visuchika, person will have the Annavaha srotho dusti lakshanas will be there, and Visuchika, Suchivat Bireva Lakshana will be seen. And in the Alasaka, the food movement will be restricted. So the modern exact correlation we can't make, but according to the symptoms, we can make some correlations. Okay.
Sir, the next question is Agni Mandya and Mandagni are same?
No. See, Agni Mandya and the Mandagni. Agni Mandya will lead to the both are in the they are used as the similarity. See, Agni is there. I told the 3 types of Agni: Vishamagni, Tikshnagni, and Mandagni. So Agni Mandya and Mandagni is almost they are similar. Okay, they are similar only. Okay, and its effect is also same.
So the next question is how to differentiate the types of Agni, like physiological or pathological, like Mandagni in the Kapha Prakriti, from Mandagni as the pathology.
Yes. See, it's a very important question. See, and very importantly, we need to understand in the patients. Very apt question it is. Prakriti is there. Vataja, Pittaja, Kapaja, Prakriti is there. Vata Prakriti person will have some Agni. Pittaja Prakriti will have the some Agni, and Kapaja Prakriti will have the some Agni. But Prakruta Agni is the Samagni only. If the person take the for example, they had given with the Kafaja Prakriti. Kafaja Prakriti person is there. Think as I am a Kafaja Prakriti person. I need 3 hours for a digestion. Okay, because I may be having a little less Agni, but it is summer for me. But when it is 3 becomes 6 hours, then it is lead to the Mandag. Okay, same thing if the person with the Tikshnagni is there. Person will he is not having a Tikshnagni, he is having a Agni, he will digest within 2 hours or 1.5 hour, half an hour. It is summer for him. But when it will become 3 hour, 4 hour, then it is Mandagni for him. If it is became half an hour, then it is also Tikshnagni for the Pittaja person. Is it clear? So the Agni quantification has to be done on the personalized. So it is a personalized assessment in every individual. Every individual have the different level of the Agni, and according to that, we need to assess.
Any other doubts? Students, all delegates, if you have any doubts, please put in the chat box. Sir, sir, can you explain cremation? Sir, another question is there.
Yes.
So, can you explain cremija chardi and where does its reference is? Cremija
Okay.
chardi, sir. The reference
See,
and explanation they need.
yeah.
Cremija
See,
chardi.
Krimija Chardi is there in the when the Krimi is explained. So we have the basically Amashaya Shleshmari Krimi is there leading for the Chardi. Then we'll call it as the Krumija Chardi. At that only we have the reference of the Krimija Chardi.
Yes. Sir, I hope we have covered all the doubts, sir. Sir,
Yeah.
thank you so much, sir, for accepting our request to be as a resource person of the National Webinar Nidana Siddhi 2022 for sharing your valuable knowledge and clearing the concepts very effectively. Once again, thank you so much, sir, on behalf of S.B. Ghadia Ayurvedic Medical College, Hospital and Management, sir.
Thank you, ma'am. Thank you.
Shall we conclude, sir?
Yes, ma'am. Thank you.
Okay, sir. Thank you, sir. Sir, okay. Okay.